Welcome to Cervical Cancer Awareness. Today we are diving into this important topic and raise awareness about cervical cancer. In this video, I will be answering a few basic questions asked on cervical cancer. So if you also have questions concerning this topic, be ready to get your answers. To delve in, let's start by understanding the basics of cervical cancer. Cervical cancer is a type of cancer that develops in the cervix, the lower part of the uterus. It is primarily caused by the human papillomavirus HPV, particularly variants 16 and 18. It's important to note that HPV is a common virus transmitted through sexual contact. First question: what are some of the risk factors associated with cervical cancer? There are several risk factors that can increase the likelihood of developing cervical cancer. These include having multiple sexual partners, smoking, a weakened immune system, giving birth before the age of 17, having multiple children, a family history of cancer, socioeconomic status, and a previous history of cancer. However, it's important to remember that anyone can be at risk regardless of these factors. Second question: can you shed some light on the symptoms of cervical cancer and how it is diagnosed? Certainly, it's important to note that cervical cancer often does not show any symptoms in its early stages. However, as it progresses, symptoms may include unusual bleeding between periods and after sex, pain during sex, smelly, watery discharge, bloody discharge, pelvic pain, general weakness, difficult or painful urination, fatigue and weight loss, and even diarrhea or blood in the stool. Regular screenings, such as pap smears, can help detect any abnormalities in the cervix, and further tests like HPV tests can confirm the presence of the virus. Third question: are there any preventive measures that individuals can take to reduce their risk? Absolutely, but you have to know prevention is key. Firstly, getting vaccinated against HPV is crucial, especially for children below the age of 13. Regular screenings such as pap smears and HPV tests are recommended for individuals aged 25 and above. It's also important to practice safe sex, use condoms, maintain a healthy lifestyle, and prioritize genital and menstrual hygiene. Fourth and final question: if cervical cancer is detected, what are the treatment options available? Treatment options for cervical cancer depend on the stage and individual circumstances. In the earlier stages, removal of the cancerous tissue can be curative. However, as the cancer progresses, more extensive treatments such as surgery, radiation therapy, and chemotherapy may be necessary. This is why routine screening is so important. Women aged 21 and above should undergo pap smears every few years to detect any abnormalities early on, that is, the precancerous cells in the cervix. That's all for today's episode of Cervical Cancer Awareness. I hope all your questions was answered, but if your question wasn't answered, please leave it in the comment section. Don't forget these valuable insights on cervical cancer and the importance of awareness and prevention. Remember, everyone needs to get vaccinated, practice safe sex, and prioritize regular screenings. Together, we can take control of cervical cancer. Thank you for watching till now. Remember, knowledge is power, and by being proactive, we can protect ourselves and our loved ones. Stay healthy, take care of your health, and see you next time.